Hi, my name is Gerardo. I'm a family doc, and I believe doctors should spend more time with their patients and less time in front of their computers. I'm from Mexico, and I finished my postgraduate education here in the US. I've been living in California for the last 8 years. I've been working as a hospitalist at Kaiser Permanente ever since the pandemic started. I take care of patients who are very sick and required to be hospitalized. Taking care of acutely ill patients is very mentally stimulating. It's like playing detective, having to find clues in the patient's history, the labs, and imaging studies. The answer to the diagnosis usually lies in between all these clues. I work as an nocturnist, which means that I work exclusively at night. Working at night is very different from a day shift. There's usually less chatter around, and usually you have a more peaceful environment at work. But then there are intense episodes full of adrenaline, like when your patient is coding or you're calling to a rapid response. Before working as a nocturnist, I used to work in the clinic, providing primary care, treating conditions like diabetes and hypertension, and providing care for patients with minor illnesses like colds and rashes. I love my daily patient interactions and the long term doctor patient relationships that you forge by providing continuity of care. The feeling of earning the patient's trust is invaluable. That's definitely one of the main reasons I chose a career in healthcare. It's a very rewarding feeling when you can help a patient that is sick or suffering. And they are also very grateful when you empower them to take control of their health and lifestyle. While working in the clinic, I experienced firsthand the burdens of medical documentation. Some days I felt like I was a professional data entry clerk. Doctors used to document their patients' visits on index cards. Then we transitioned from written notes in paper charts into typing out our notes in electronic medical records. Typing out our notes in the computer can be time consuming. Electronic documentation not only takes more time, but it also interferes with our patient interaction. Almost 50% of physicians in the US experience some degree of burnout. And one of the main causes of physician burnout is medical documentation. Over the years, I created a compilation of boiler templates that I use to write my patient notes. We call them dot phrases in the medical community. I accumulated over 1,000 of them, and I would use them every day to expedite my medical documentation. It helped me become more efficient at work. I noticed it really helped me have a more meaningful interaction with my patients. I wanted to share my work with my colleagues, and last year decided to publish a book with my dot phrases. The book became very popular. It is frequently featured as a number one bestseller in the Amazon charts for practice management. This inspired me to start a company early this year, StatNote. It empowers clinicians with technology and efficiency tools to expedite medical documentation and bring back the joy of practicing medicine. It not only helps clinicians spend more time with their patients and less in front of their computer, but also by documenting more accurate, timely, and complete medical records, they improve their productivity and revenue. Our ultimate goal is to help clinicians prevent burnout by having more meaningful interactions with their patients and help them achieve a better work-life balance. My goal as a doctor and as a startup founder is to have a positive impact in the lives of my colleagues and the patients I serve. Later this fall, we're planning to launch our first web app that will allow clinicians to document their medical notes in a smarter and more efficient way. We hope to revolutionize medical documentation with technology that empowers clinicians and hope in the next 5 to 10 years to integrate artificial intelligence and machine learning into other practical solutions that affect the daily workflows in healthcare. As a doctor, I think it's very important to have a say and shape how technology affects our daily lives and the lives of our patients.